To really understand why Regenexx is very different, let's take a look at one of our procedures. What you're about to see, your orthopedic surgeon can't do, the guy down the street that does a little bit of ultrasound can't do. So let's take a look at this advanced, precise, guided work. Let's take a look at what interventional orthopedics looks like in the neck.
This procedure will be bilateral C0, C1 facets, C1, C2 facets, and a C7, T1 facets. The very upper joint between the base of the skull and the first facet is a joint that 99% of pain doctors have never been trained to inject. And that's because with the traditional pain model, usually you're injecting the joints just for temporary relief to see if they'd be a candidate for burning the nerves that innervate the joint. Since there are no easily accessible small nerves that innervate this joint and that can be burned, most doctors will ignore these joints. In this procedure, we have to be ultra precise with our needle. So now it looks like we're in a joint. We're going to inject contrast dye. It's an additional safety measure to make sure we're not getting any injectate in the blood vessel, and to make sure it's going exactly in the joint. Beautiful contrast flow filling that joint. Sometimes this can provide some diagnostic utility as well. If we see contrast leaking out, we know the joint is a little bit incompetent, meaning the ligaments around the joint are unstable. And so again, as part of our Regenexx methodology is always to treat instability in the ligaments. So if we see that, we will treat the ligaments around this joint as well. We do see a little bit of leakage there. So with X-ray guided procedures, we're taking a spot live picture. So we move the needle, take a picture, see where we are, move the needle, take a picture, see where we are. In addition to doing the facet injections as well as the epidurals, we'll also be treating the supraspinous and interspinous ligaments. Again, with the Regenexx methodology, we want to address joint and neck instability because excess motion, instability, can lead to increased wear and tear on the joints, on the disc. It can cause some pinching of the nerves and become tighter.